my name is Brooke Stewart and I'm a nursing student at the University of Pittsburgh. First, I will be reviewing with you how to use the syringe, and then we will be practicing giving injections. So remember to pop the top and then wipe it off with the alcohol prep pad. You will be picking your syringe and your needle based on what you are giving and where you are giving it. The first thing we will be practicing is giving a subcutaneous injection of insulin. We're looking to find a syringe that's calibrated in units because we measure insulin in units. We are going to be pretending your normal saline is insulin. We need to give 10 units of regular insulin. Sometimes insulin syringes have a cap on the back, so you need to remove it from the collar. You'll take the cap off of the needle next. You're going to put 10 units of air into your insulin syringe. Now inject the air and pull back 10 units of insulin. Now inject the air and pull back 10 units of insulin. You want to flip your bottle upside down, holding it between your pointer finger and your middle finger. Then insert the needle into the bottle. Oh, God. Once you have the air in your needle, hold your bottle between your pointer finger and your middle finger, close to the top, and flip it upside down. Then insert the needle into the bottle and inject the air. Once you've done that, you can get a free hand by using your ring finger and your thumb to hold the syringe. Now you have a free hand to pull back the plunger and get the proper amount of solution. Now you're going to hold the syringe up to your eye and check that you do indeed have 10 units of insulin. If you don't have enough, you'll have to go back to the vial and pull in more. If you have too much, you can just squirt it out. Once you draw up your insulin, you need to recap your needle. So now we will be practicing injecting. I've done all the checks and now I'm ready to administer this drug to my patient. Prepare the patient's skin. You will inject the needle like a dart at a 90-degree angle. You will inject the needle like a dart at a 90-degree angle. You will inject the needle like a dart at a 90-degree angle. Okay, then we'll remove the cap, pinch the skin, inject, and insert. So I'll remove the cap, pinch the skin, and inject the medicine, then release. You can also give insulin at a 45-degree angle rather than a 90-degree angle. You can also give insulin at a 45-degree angle rather than a 90-degree angle. Just to control the skin at a 45-degree angle, you want to hold the skin taut on either side. A couple things to remember. First is never set your needle down. That will contaminate it. Never recap a needle that you've already used. When giving an IM injection, you want to hold the patient's skin taut. You're going to give it at a 90-degree angle. And because you have to aspirate, you want to hold the syringe close to the top. Then you want to inject the needle fast like you're shooting a dart. And without moving the syringe, you want to pull up on the plunger to make sure no blood comes out, so you have not hit an artery or vein, and then slowly you want to inject the solution into the patient. Make sure you go fast like a dart so you don't hurt the patient. And without moving the syringe, you want to pull up on the plunger to make sure no blood comes out, so you have not hit an artery or vein, and then slowly you want to inject the solution into the patient. When giving a Z-track injection, you want to pull the patient's skin to the side, insert the needle, aspirate, and then inject the solution. Now you're going to take the needle out and quickly let the skin go. So pull back on the skin, insert the needle, hold with your non-dominant hand, pull back on the plunger, and then inject the medicine slowly. Remove the needle and then release.